Hello friends, myself Dr. Sachin Marda. I am Senior Consultant Oncologist Director at Yashoda Hospitals, Somajiguda, Hyderabad, India. In this video, we'll come to know something about childhood cancer, understanding childhood cancer. Friends, this is very critical area when we treat cancer patients. Treating adult cancer patient is one thing, but treating the pediatric or childhood cancer patient is difficult. As many organs in our body, the cancer can come to that particular part also. For example, most common childhood cancers are blood cancers. We call them as leukemias. Second, when it comes from the lymphoma or lymphatic system or lymph nodes, we call them as a lymphoma. Tumors which arise from the brain, we call them as a glioblastoma. And same like liver tumor, hepatoblastoma, kidney tumor, angioblastoma, soft tissue sarcomas, Wilms tumors. So these are different types of childhood cancers what we see commonly. It can come from the age of 1 month to 12 years of age. The symptoms mimic with like normal issues like fever or pain, because we can't differentiate between the cancer symptom or it could be some normal symptoms. So we have to be little careful. If the child is having unbearable, commonly occurring pain in abdomen, let us find out. Then suppose there is any lump palpable in the abdomen or any lymph node or gland palpable in the cervix, in the neck area or in the axillary area, it could be lymphoma. Then suppose if the patient has, a child has a convulsions, fatigue, I call them as fits, in layman language, convulsions, vomiting, this could be a sign of brain tumor. Unexplained weight loss or irritability, or child is failure to thrive, the growth is not good, or he is not eating well, weight loss is there. So these are generally cancer symptoms. So first of all, we do normal test, whether blood test and some scans, ultrasound, and if we find some abnormality, then we do biopsy, for example bone marrow biopsy or lymph node biopsy, and then we do PET scan or some other scans to diagnose the cancer and also to stage the disease. And then as per the stage, there are different modalities of treatment. Now the medical technology has grown by leaps and bounds. So we have many good options available without much side effects. So for example, if the tumor is operable, like a Wilms tumor or kidney tumor or brain tumor, we do a surgery. Now there are very advanced procedures like robotic surgery or laparoscopic surgery or minimally invasive surgery. These are the options for pediatric patients. And then some cancers, they can be cured with chemotherapy or targeted therapy or bone marrow transplants. So there are different options available depending on the age of the child, stage of the child, the area where it has spread. After treatment, the child has to be under observation for next 1 or 2 years so that we will keep that the cancer is under control. And then if everything is okay, I think we can just keep him under follow-up. The fourth important point is how we can support the children, because the managing childhood cancer treatment is, yes, we will give, but managing their emotions or the managing finances or when it comes to the child is very difficult to cope up. So all those things requires counseling. Here are few tips. Let your child involve into the various activities like painting or drawing or singing or some whatever hobby he has, and also involve them in decision making. Play with them. You can take them to the garden or park or anywhere. So like that, if we involve the child from the treatment aspects or from the emotional aspects, I think the outcomes are much better. There are many support groups which can help the childhood cancer or the patients or the families who have gone through such treatment for their kids. You can enroll into the support group, and then collectively I think we can give our child the best treatment and the best possible outcome when it comes to the childhood cancers. So this is, I feel, as a being oncologist, we always happy to treat adult cancer, but when it comes to the pediatric or childhood cancer, obviously the emotions comes up, and then we have to manage the emotional part and financial part as well. So I hope you like this video, and if you want further information, you can always mail to us, write to us. We'll be more than happy to respond to you. Thank you.
Like, comment, and subscribe for more health updates.